So spinal stenosis is a narrowing of the spinal canal, and what it does is it can put pressure onto the nerve roots that run down into the legs. With most of our patients that have spinal stenosis, they'll have a combination of both low back and leg pain. When spinal stenosis becomes more moderate or severe in nature, the patients will describe what we call neurogenic claudication, and this is that the pain increases when they're walking. The pain is relieved by either sitting down or leaning forward, and is worsened with prolonged periods in one position or prolonged periods of standing.
So some of the symptoms with spinal stenosis is what's called neurogenic claudication. That means patients have pain or weakness with walking. A lot of times pain and weakness from spinal stenosis is improved from bending forward, and that's why so many patients that have spinal stenosis use a rolling walker and walk with a stooped position, because that takes the pressure off of their spinal cord, as well as the nerves that exit their spinal cord and go down their legs.
So what Vertiflex does, it is a spacing device that prevents the spinal canal from causing more pressure and worsening stenosis. For instance, when the patient extends their back or when they stand up. These are normally the periods of time with spinal stenosis that are more painful for the patient. So it slightly opens up that area in the back and also prevents further narrowing around the nerves.
The Vertiflex device is a titanium implant that is placed under light anesthesia with a small incision. Generally takes me about 30 minutes to do this procedure, where we place this implant in between the spinous process of the vertebrae. What that does is it allows the spinal canal and foramen, which are the tunnels here, to remain open, that typically a patient would achieve in a flexed position. It's a pretty quick procedure. It takes about 30 minutes. You can do 2 levels if the patient has 2 levels of narrowing. It requires light anesthesia, small incision about this big, and a lot of times patients see or notice improvement within a day from having this procedure done.